My name is David Melby. For a number of years, I've been a strong interest in the development of strategies for addressing our national obesity crisis, particularly as it relates to children and adolescents. I'm here today to represent the American Heart Association, in which I've been a volunteer for a number of years. On behalf of the association, I'd like to thank you for this opportunity to testify today. As many of you know, building healthier lives free of cardiovascular disease and stroke is the American Heart Association's mission, and one we take very seriously. The Heart Association strongly advocates, let me back up a moment here and indicate that I will make comments today on 4 areas and recommendations. The first is menu labeling. The Heart Association strongly advocates for calorie labeling on all menus and menu boards at the point of purchase in restaurants to help consumers make informed food and beverage choices. Restaurant menu labeling is gaining momentum across the country with successful initiatives in a number of states as well as municipalities such as New York and Philadelphia. Menu labeling is an inexpensive, common sense prevention measure that will help reduce obesity and other risk factors for heart disease and stroke and health care costs. Annual medical spending, just direct spending alone on overweight and obesity, currently runs as high as $92.6 billion annually, about 9% of our national health expenditures, and that's only the direct costs. Indirect costs increase that total. The second area is physical education in schools. The Heart Association recommends a minimum standard for elementary students of 150 minutes a week of PE and 225 minutes for middle school students. We also recommend that successfully completing PE be a requirement for graduation of high school. States should develop standards for student learning in PE that reflect the national standards and should require that PE be taught by certified licensed PE teachers. States should also work to assure that physical activity is being incorporated into the school day. The third area is school nutrition. We are now raising the heaviest children in our nation's history. About 70% become overweight adults, leading to an increase in cardiovascular disease, our number one killer. But we can help kids live longer, healthier lives by insisting that states require schools to provide improved nutrition standards. To make matters worse, unhealthy foods and beverages are available throughout the day in many schools across the country, and only 21% of high school students have reported eating fruits and vegetables 5 or more times a day. The Heart Association supports policy efforts on the state and local level to strengthen nutritional standards in schools and to update current state nutrition policy guidelines for competitive foods and beverages sold outside the federally reimbursable school nutrition programs and for food sold in vending machines and snack shops. The fourth area is safe routes to school. Safe routes to school is a movement to create safe, convenient, and fun opportunities for children to bicycle and to walk to and from schools. The Heart Association advocates for continued funding of this program at the federal level and for successful implementation of these programs at the state and local levels. Thank you again for this opportunity to testify, and thank you for being here and for giving Southern Illinoisans an opportunity to have input on this important issue. Please be assured that the American Heart Association is on board with this issue and is very committed to making a difference.